Hello and welcome to the third unit in our online pharmacy practice course. In this unit, we are going to cover the Medicine Use Review, MUR, which is a service provided in UK community pharmacy. There will be a quiz at the end of a unit to assess your learning. By the end of this unit, you should be able to understand the concept of MURs, recognise the importance and benefits of MURs on patients' care, and understand the process of conducting an MUR. The Medicine Use Review Service was commissioned in England and Wales that seeks to establish a picture of a patient's actual medicine use and support understanding and adherence to therapy. It also aims to resolve medicine-related problems, address medicine-related concerns to reduce avoidable waste. MURs have been available from community pharmacies since 2005 and are free to patients. The service requires pharmacists to organise the MUR as a one-to-one consultation and to offer this to patients annually. This allows pharmacists the opportunity to hold private conversations about the patient's daily use of medicines. These interactions differ from the limited and brief shop floor counselling encounters that occur at the time when medicines are handed to patients. The NHS provides a fee of £28 for each review performed and allows a total number of 400 annually that each pharmacy contractor can claim. Pharmacists must be accredited for additional training, demonstrating nationally set competencies before they offer the service. Pharmacy support staff are often involved with identifying eligible patients for MURs during the routine labelling and assembling of a patient's medicines, and at times offer the service to patients. However, they are not required and often do not receive formal training about the service. The aim of MURs is to improve patient knowledge, adherence, and medicine use by establishing patients' actual use, understanding and experience of taking their medicines, identifying, discussing, and resolving poor or ineffective use of their medicines, identifying factors such as side effects and drug interactions that may affect adherence through identification of polypharmacy by going through each medicine one by one, improving the clinical and cost effectiveness of prescribed medicines and reducing medicine wastage. Benefits of MURs therefore addresses adherence issues, as this consultation allows patients an opportunity to voice their concerns and ask questions regarding their treatment. This contributes to the better management of long-term conditions with the potential to prevent readmission to hospital. This in turn reduces the burden of NHS costs. MURs also increases patient safety by preventing errors and missed medications. MURs can be done on targeted patient groups. These are patients who are most likely to benefit from this service and achieve better outcomes for the healthcare as a result. Targeted patient groups for MURs are patients taking high-risk medications such as antibiotics, opioids, anticoagulants, insulin, non-steroidal anti-inflammatory drugs like long-term ibuprofen, and antiplatelets. Another targeted group are patients recently discharged from hospital whose prescription was changed. Ideally, patients discharged from hospital will receive an MUR within 4 weeks of discharge, but in certain circumstances, the MUR can take place within 8 weeks. Patients with respiratory disease, such as asthma, are also targeted, as well as patients at risk or diagnosed with cardiovascular disease and regularly being prescribed at least 4 medicines. High-risk medications are targeted because they are associated with preventable hospital readmission. Harm can also be caused to the patient by omission, incorrect use, or benefits are lost by patient not taking the medication. Harm can be prevented if a pharmacist can deliver to the patient why it is important to take the medication. It is important to document patient's consent before carrying out the MUR service in a consultation room, which is separate from the rest of the pharmacy. This is because information is usually shared with the patient's general practitioner. A standard form is used for MURs, which we will see later on. This provides a consistent service delivered to patients throughout the country and allows an audit trail. Pharmacists are also specially trained to use this form before carrying out MURs. The components on a standard MUR form are the following: a confirmation of a patient's details such as name, NHS number, date of birth, and contact details, the patient's general prescriber details, pharmacy details including name of pharmacy and address. The type of review, this is either an annual MUR or an intervention MUR, which is usually done when the pharmacist identifies a patient who would benefit from a review. For example, it could be that the patient is on multiple medications and struggles to remember when to take what medicine. Details of an action plan is also included, highlighting issues of medications and recommendations. A list of the current medications is also written onto the form from either the patient's medical records, through discussion with the patient, or a mixture of both, which is the majority of the time. This list includes items that they have bought themselves in a shop or a pharmacy, as well as complementary therapies such as herbal remedies. Through an MUR service, pharmacists are well placed to offer further information to the patient regarding their treatments, resolving ineffective medicines use. Here is an example of what a standard MUR form looks like. On the next slide, there will be an example MUR consultation between the patient and pharmacist. Please watch closely.
Hi, my name is Jai and I'll be your pharmacist today. So according to our system, it says you're due for your annual medicine use review. Is it okay if we just have a little chat about your medications?
Yeah, that's fine.
Okay. Is it also alright if I make some notes, just in case I have to send that over to your GP?
Yeah, that's fine as well.
Thank you. Before we get started, can I confirm your name, your address and your GP's details, please?
Yeah, my name is Jane Cho. I live at number 1 Manchester Road, M1 3PL. My GP is Dr. Smith at the Stopford Medical Centre.
Okay, brilliant. So, let's get started. So, how are you getting on with your medications? Are you experiencing any side effects with any of them at all?
No, I think I'm okay with my medications. I'm not experiencing any side effects. Just feel like my asthma is well controlled generally.
Okay, great. If that's the case, let's just run through your current medications. Okay. So, on our system, it shows that you're on the Seretide 250 Evohaler, the Salbutamol 100 microgram inhaler, and the Fluticasone 150 microgram nasal spray. Is that correct?
Yeah, that's right, but I'm no longer using my Fluticasone nasal spray.
Okay.
That was just prescribed to me last year for hay fever.
That's fine. If that's the case, if you no longer require it, then I suggest that we'll discontinue that. Is that okay?
Yeah, that's fine. I've not been using it for over a year anyway, so I don't really need it.
Okay, that's fine. So tell me a little bit about your salbutamol inhaler and how are you getting on with that. So on our system, it actually says that you've picked up 10 inhalers over the past 12 months. It suggests to me that you're using the inhaler a bit too often.
Right.
Can you just explain to me how you've been using the inhaler?
Yeah, so I've just been using 2 puffs 4 times a day, as it says on the instructions.
Okay, right, okay, that might explain why you've had so many. So basically, with salbutamol, on the instructions, yeah, it does say that you are taking 2 puffs 4 times a day, but you also says PRN, which is actually it actually means when required.
Oh right, I see.
As salbutamol is a reliever inhaler, you actually only need to use it when you feel a shortness of breath.
Oh right, so I've been using it wrong all this time. I wish someone would have told me sooner. I'm so glad I came to this consultation today.
No, that's okay. That's why we do these reviews, just to make sure that you know exactly what to do with your medication. So, tell me about your other inhaler, the Seretide. How are you getting on with that?
Yeah, I think it's been okay. So I'm currently taking 2 puffs 2 times a day, so once in the morning and once at night. Is that correct?
Yes, that is correct. The Seretide is a preventer inhaler.
Okay.
It's longer acting, and that's the one you should take on a regular basis.
Right, I see.
If that's the case, is there anything else you'd like to ask or for me to clear up?
No, not really. I mean, I'm just glad that I found out I was using my other inhaler in the wrong way. Do I have to tell my GP about that?
Oh, no, it's okay. Again, that's why we do the reviews, just to make sure you know exactly how to take your inhalers. And don't worry about the GP. I'll be sending over the notes that I've made after this
Okay.
consultation over
Mhm.
to him anyway.
Mhm.
Is there anything else you'd like to clear up?
No, that's everything. Thank you so much.
Okay, brilliant. Well, if if you do run into any problems in the
Mhm.
future or have any queries, just
We have now come to the end of this unit. You should now be able to understand the purpose of MURs and know its aims, which is to improve patient knowledge, adherence, and medicine use. This has a further positive impact on improving patient safety through preventing errors and missed medication. You should also be able to recognise the benefits of MURs on patient care, mainly that MURs addresses adherence issues. This is because patients will have a chance to talk through their concerns and ask questions regarding the treatment. This further reduces potential costs for the NHS as it can reduce readmission to hospitals due to patient counselling. You should also know that there are 4 targeted patient groups for MURs. However, pharmacists can still carry out MURs on any patient they identify would benefit from one. To conclude, the key components of an MUR consists of an action plan of issues and recommendations, a list of current medications, checking patients' knowledge on the medications and adherence, and confirming whether or not the formulation is appropriate alongside any reported side effects. We hope that you have enjoyed this unit and find it useful to know how medicine's use is enhanced in the UK. We look forward to welcoming you again to the last unit in this series.